This is my first research project since I complete my obstetricians and gynecology residency training program a few years ago. Currently, my responsibility include clinical service and teaching in a general obstetrics and gynecology for the medical student, interns, and ward-based trainee.
Yes, and for me, I'm Dr. Pornpimon Suriyachai. I'm the head of Department of Obstetrics and Gynecology of Payao Hospital. So I has published a few research papers about pregnancy women before, and I'm the supervisor for supporting and supervising our junior about the research here too. After I got a degree of obstetric and gynecologist, am interested in the topic about the pregnancy, especially that something that can use the answer of the research that can use with real people in our hospital. So such as modified ERAS that can be used in the pregnancy woman, because maybe ERAS is not suitable for our patient, because our patient maybe some is a emergency patient for cesarean section. And I think that the experience that this one is motivate me to focus on clinical relevant research question.
Okay, so for me, during the residency training program around 2020, there's an increased adoption of the ERAS protocol for the elective cesarean section in Thailand. That's really influenced my academic interest. So after observing the improve of pain control and shorter hospital stay and also no complication in the patient, so I try to figure, can I apply this in the emergency setting. So this experience changed my research to approach focusing on the clinical relevant practical outcome, include the postoperative pain and length of hospital stay and easily accessible indicator for the bowel function. Although many studies have shown the benefits of ERAS, I initially expect that just for emergency setting, because I not really use the all protocol from the ERAS, I just try to apply in like some part of intraoperative and postoperative care. So I call it modified ERAS. I want to see how can that apply to my patients. And I just expect the main improve in only the gastrointestinal recovery. However, I was surprised to see the significant improve at 48-hour pain score in the modified ERAS group. Even though the mean pain difference, the mean pain score difference is so small, just only 1 point, but the patient in this group are more likely to have the mild pain, which together with the early recovery of the gastrointestinal function, so it's these two things more likely to support the shorter of the length of hospital stay. When reviewing the literature, I pay particular attention to the clinical relevance and feasibility of the strategy aimed at optimizing postoperative pain control, early feeding, early ambulation. I think this one can be the key determinant to the recovery. So I see the important direction adapting of modified ERAS principle to broader and more complex clinical setting, include a high-risk obstetric case and uncomplicated emergency gynecologic surgery. Expanding the evidence-based recovery protocol beyond the elective procedures, it had been potential significant improve the patient outcome and redefine the standard post-operative care in at least in my hospital.
For me, I think research should start with a good question that have a result that you can use in the real situation, and you have to follow closely about the step of the research methodology. And even though there are many difficult process that you should not give up, and you keep practicing writing manuscript, and then it will get better and better.
And this is my first research project in a limited resource setting, because I have to say my province is really small. So my main advice is to follow the established guideline, as my head said, as close as possible. Even in a small hospital, applying the recommended standard can greatly improve the quality of the study. I also believe this is a good opportunity to show the meaningful research can be conducted in the resource-limited setting. Finally, I'm very grateful for the support of my research team, the reviewer and CEOG team, which play an important role in the completing this paper. I've learned about the CEOG through the journal supervisor in my university. So this was motivate me to submit because it was focused on a clinical relevant and it brought international audience. Okay, this was very supportive and positive experience for me, especially for the first-time author like me. The peer review process provides valuable and constructive feedback, and the close follow-up from the CEOG team made the submission and the publication process smooth and reassuring. I have no specific suggestion for the improvement. It's really clear and well organized in the website. You can see it in the website. So I would definitely recommend CEOG to my colleagues and my friends, especially for the supportive peer review process and the responsive editorial team.